Do you think we're gonna pay attention to her?
Absolutely, always.
So absolutely not. Okay,
I didn't have choice.
we have no, we're not,
So-
we don't, it don't matter. The question, I could hunt you down, then it'll be longer. I wanna get rid of this and get it done and
All
over
right,
with.
okay, I'll
We're
shorten
not
answers.
comparing you to Hitler, okay?
Thank you.
We are not.
Good.
You seen the TV show when Hitler, the generals, were approaching Hitler to tell him that the war was going the other way? Remember
yeah.
that part?
Well, yeah.
And nobody wanted to say to Hitler that the war was going the other way. Who approached you and said the Justice Building was $90 million overdue?
Well, it would have been a report we would have seen, got from DTI at some point that said we're getting out of hand here in terms of cost. However, it's not just that building. I mean, every project, every project we see is up 20-25%.
Because of what's going on.
All the supply, all the costs, everything.
But 90 million, so what's going to happen there?
Well, I mean, we'll have to balance that out over time. We'll continue to build it, but it may take longer. Because we will look at how we manage it, so we're not coming back. Some people say, well, just raise taxes. Well, no, that's not on the radar.
No, because every price goes up. It's been
But
all
it's-
around the world with the Ukraine war.
Yes,
and
yes, and
what
now another one
happened
in Israel, that's right.
Israel, and then, right now, we can't start talking about that because we could go on here for an hour. Robert Gauvin didn't stay long. Daniel Anand looks like he's coming back. Somebody asked, he says, do you know there's a French population in New Brunswick?
Absolutely.
You
Absolutely.
go, these liberals go there for photo ops and go
Yes.
to events. And is there like that housey?
Well, isn't it sad that if you go back and you look at an organization like Lac-Qui Nouvelle, and they have been hammering on me ever since I came along.
Really?
And so they continue to divide the province.
Don't the government give like a Nouvelle
The
money?
government, they have a $10 million, $10 million bond or anyway, basically which they get probably, I don't know, it depends on the interest rate, but maybe about $500,000 a year off of this bond that was done back many years ago.
Years ago. You have no interest.
Well, my problem is this, is I understand the cultural benefit. What really is annoying is it is a political football to support the Liberals.
How many people read it like I did Nouvelle anyway?
Well, it's certainly, if you go through Francophone New Brunswick, they do. And if you read Lac-Qui Nouvelle and it's always about negative about me, then at some point you say, well, why would I ever support Higgs?
Yeah.
So then we have this divide that appears to be linguistic, but in many ways it is a political divide that is perpetuated, which is really unfortunate for the capability and the opportunity for our whole province.
Okay. Are you educated right now on the issue of drugs?
Not enough,
Not enough.
but if you'd read the throne speech, which you haven't,
Which I will.
but if
I'm
you
a man of my word.
I know.
I will.
I didn't say you wouldn't. I just said you told me you
will.
hadn't.
I will.
But there is a paragraph in there about a drug and mental health rehabilitation center, recovery rehabilitation center, and that is a program. Now I know that Susan Holt said yesterday that she didn't know she didn't necessarily believe in that you couldn't get people to go to it and get treatment and all this, and I guess the point is when you talk about people that need help, that are on the street today, living in drugs, and you often talk about that, we need a place to recover and rehabilitate these individuals.
But you can't. They won't go. And
Well,
it's
you have
just-
said yourself many times of the safety aspect.
Yes, very
Right?
dangerous.
Exactly. So what are we waiting for? Are we going to wait till someone is critically hurt, a passenger, or not passenger, but a citizen walking by, and they get attacked because of someone that is overdosed and is in trouble?
Somebody, I guess I won't have time, go to ask you on the street, but somebody asked me daylight saving time. You were saying it was a time maybe to change it.
Oh, I'd be fair with that.
Now it's going to get
I know.
darker
I know.
sooner, and then the crime. It's going to not be safe to walk
Well,
the streets.
that might be another reason, but we can't do it in isolation.
No.
We've all said, it's
They
almost
gotta
going to
be
be
around the
yeah,
world.
Yeah.
I always found it strange. So is it time to look at the kids? I had one guy come to me very upset and said, compared to marijuana or crystal meth, is there a drug of choice? Isn't time to really educate our kids in school and say, this is a big faux pas?
I think it is, but I know that a lot of people don't. But yes, I think there's more education required, but I think there has to be more focus on recovery and
Once you do
addiction
it,
treatment.
that's it. Anyway, we already talked about that. What about the warming center? You got something in mind, or like these local security people? Which has been good in Fredericton compared to last summer. And
We've got a
even,
lot more security people there now.
yeah, not cops,
No,
security.
Public safety trained public safety officers that are now trained well beyond what they used to do.
The city said they got to pay $600,000, and they asked the province for help, and it helped. You think you would look at
Well, we
that?
probably would, but we'll look at every city in that sense because we are putting a lot of money into the city. And the city has gained a lot in the last few years on the assessments and the revenue that comes directly from that. So, cities talk about the revenue stream. Theirs has gone up dramatically.
Well, people will kill me. I know. See, people look at me when they watch these videos. They say, who's that woman in the back that always say, okay, that's enough, that's enough.
Well, you should turn the camera on. And they
Yeah,
don't.
no, won't do that to her. But the voice, who's that? I laughed. I said, never mind her. They said, we're almost done. Never mind. So
We
we're
got another
almost-
42 questions.
Yeah, no, it's okay. We'll get this done in no room. And then in 2 months from now, you'll meet me again.
No.
Because don't say no. Because it's the end of the year. Don't even hurry. I was supposed
All
to
right,
meet you this
year-end
summer.
report.
Let me focus here. Okay, see? And that's why we got the chocolate milk. Healthcare. If I
Yeah.
didn't talk about that, I'll be shocked. I was there yesterday for surgery, and I was laying down and I could hear in the hallway, thank you. That's the two famous word in the healthcare system. Thank you. Are you working today? And they get stuff and they say, thank you. The staff, very polite. So from
That's
a
lovely.
scale,
That's great to hear.
no, they're very polite. They're unsung heroes. The rural nurses that's going in the country, right? They're unsung heroes. Mental illness, a terrible thing they have to deal with these people. A scale of 1 to 10. 10 is the best. What would you give our healthcare system here compared to other?
Well,
provinces?
I think it depends on system or personnel. I mean, I'd rank our personnel up there with any in the country. The system itself, we're still trying to work through changes in that, and we've made changes in that. And I want to, in the throne speech, we'll cover a lot of that, but it talks about the different access to primary care, the different cases. But what has changed, Charles, is we don't have doctors that want to work the same hours or the same number of patients they used to have, and I get it. Lifestyles have changed, and that's not unique to doctors. Same thing with nurses. They want to work regular schedules. They don't want to be working overtime all the time, and they want to have time for family. They want to get on a routine. We've got away from that. I mean, there's been a balance, I guess. COVID put a lot of stress on the system. People retired, and now we're building back our numbers. I mean, we've hired now. Our gap's closing on vacancies. We've hired an additional 450 nurses over and above who have retired. So we're starting to gain now on the total numbers. And it's just ramping up with many areas that are now supplying nurses and educating and all that. So the challenge we have is healthcare has to be done differently. And so the clinics and the collaborative clinic model, I taught like the one on King Street. The King Street should be seeing a whole lot more patients.
Charlie, bite your tongue. Okay.
Well, but it should. It
Yeah.
has a great resources,
Yeah.
has wonderful people there, and they could be providing a lot stronger service to the downtown area
Yes.
and offload the clinic.
The only problem with that, there's
Or the
a crystal
ER,
net
yeah.
as across the
Well,
so-called
there's
drug
both.
recovery
There's
centers
both that need to be
across.
serviced. I'm not saying that at all.
Yeah, sorry.
I just like to be able to have more routine people that can come there and be able to say, okay, you don't need to see a doctor. You need to see a nurse
Yes.
practitioner or LPN or
Yeah.
or RN. Now, so then you go to the clinical care where you have several doctors, and they are treating the clinic. So you may not have a doctor one-on-one,